Thank you for joining us on day 3 of our podcast series, Decoding the Black Box, What Doctors Miss, and Nurses, Gynecologists, and what cyber trafficking survivors need to bring up. So just a recap, we left off with a term called fetish the day previous in regards to one of the Johns and pimps and traffickers, because of a idiosyncratic symptom that was presented with a cybersex trafficking survivor. And this particular pimp / trafficker liked to engage in sex when the cybersex trafficking survivor was on her menses. And so as soon as the cycle came on, that's when he became overly aroused, overly engaged, and liked to extend the menses cycle for this particular cybersex trafficking survivor by overstimulating that area of the anatomy. Now, it turns out that our cybersex trafficking survivor had a grape-sized fibroid. But a grape-sized fibroid would not extend heavy blood flow for 3 weeks. So when we're talking about heavy blood flow, we're talking about if you've gone to the supermarket and looking at these sanitation napkins or aisle or in the convenience store, and you see those big packets of pads, and there's at least 4 levels. Our cybersex trafficking survivor during her menses were taking 2 of those size, filling up her whole entire panty, if you can imagine, with these pads. And even that was not enough. So she was bleeding out. So you can imagine what kind of lifestyle change that presented, because not only was she dealing with her existing condition with that grape-sized fibroid, but now she was also dealing with that idiomatic where an overstimulation of that anatomy area, which causes more blood flow. So you were talking about globules on the pads, like clumps of vessels on the pad, and front and back. So much so that there was a concern that some of the blood seepage was coming from the anus, and the cybersex trafficking survivor had to go to another specialist to see if there was a deviation of that would cause a blood flow to back into the anus area. And again, this is one of those symptoms that cybersex trafficking survivors would present to their physicians, and the physicians will refer them out to a specialist. And even then, a specialist needs to ask the question, are there multiple partners? Are you in the trade? Because when that survivor present themselves on the operating room, they pretty much signing off all their rights, and then have to have someone come in and pick them up for this surgery, for this operation to take place. And so you have to verify that the person who's picking them up is not someone who's their handler, or someone that the pimp or trafficker assigned to pick them up, and that is someone that the cybersex trafficking survivor trusts. So there are layers to this care for cybersex trafficking survivors at the physician's office, at the specialist's office. That's required and is needed and not often discussed. But it turns out how a fetish from a pimp/trafficker would cause an idiomatic symptom on top of a pre-existing condition that would cause a visit to the doctor's office and then a visit to the specialist. So those are the things that, unless asking probing questions, it would not be uncovered. Another thing that we discussed the previous day was that of sentient cells, zombie cells, right? Because with all the overstimulations of one part of the anatomy and other parts of the anatomy to impede movement, you're going to cause damage. You're going to cause damage to the particularly nerve degeneration, muscle weakness, and what was explained the previous day is that the result is damaged cells, damaged nerve cells, and what we call sentient cells or zombie cells that doesn't just stay at one location of the body. It spreads. And normally this turns into insulin resistance or inflammation of fat tissues, fat tissues that's hard to remove. And so this is why we had made this idiomatic symptoms that the cybersex trafficking survivor present themselves to the doctor's office with pre-existing diabetes or pre-diabetes, obesity, and other idiomatic symptoms. And the fact of the matter is, these symptoms sometimes lead to, when it comes to colds, flu, and COVID, ultimately, if they don't have the same immunity as everyone else, leads to their death. And we don't want that. We don't want that. So it's important that cybersex trafficking survivors get correctly diagnosed and that they're not prescribed heavily with antibiotics to deal with their STI infections. and they get the care that they need. So what do cybersex trafficking survivors want when they go to the physician's office? They want out of their circumstances, for the most part. Now, I shared with you on day one the first cybersex trafficking survivor attempt to go to one physician's office to another to rule out or to confirm what was happening to her so that the physician would do more existing tests on the cybersex trafficking survivor. What essentially what the cybersex trafficking survivor was trying to do was get the physician to order a diagnostic tool to uncover the biosensor chip embedded within the target and schedule an appointment to remove it. But that never happened. And the reason why that never happened is because of this. Managed care and this. Targets gets overlooked because of costs of doing exams. We have the tools to uncover this in a facility, but if they're not asking the questions, their ordeal cannot be ended. So I don't know about you. I was kind of offended that a pimp or trafficker can determine the health of an individual, the death of an individual, as well as the power and control over individuals other than themselves. And if the physician's office is a one-stop place because eventually that's where they have to go, then why aren't the physicians catching on to this? The pimps and traffickers are going to force because they have no control over themselves and exert all the duress onto the cybersex trafficking survivors, that they will present themselves into the emergency rooms, into the doctor's office or specialists, and they're going to be exhausted. They might not even understand half the questions you ask, but you need to make known about whether they're in the trade, whether they have multiple partners, what is their sexual activity like, and is it coerced? And that tells you a lot. And you can even ask, is this conversation being monitored? And you can even hold a sign if you need to. Blink yes, blink no, two for no, so that you're not alerting the pimp or trafficker who's monitoring the session that you're having with your patient. So what the purpose of this podcast series is for the cybersex trafficking survivors to eventually, when they get into the physician's office, that once it's uncovered that they have extensive internal injuries, that they check for this biosensor, anything underneath their subcutaneous tissue on them, and remove it. Remove it from our cybersex trafficking survivor and make plans to remove it. Now, because of the power and control over, our cybersex trafficking survivor, they may or may not go through with it, but most will. And those who decide not to, that's a phone call to local law enforcement to let them know that there's a pimp trafficker and what you saw on your diagnostic tools. And I say this because it's kind of irresponsible to have our cybersex trafficking survivor suffer for years under these circumstances, and for most, after a pandemic, having gone through a pandemic and under those circumstances, and just think about it. Everything got shut down during the pandemic. People were not even going to medical appointments. People couldn't even go to medical appointments unless they were undergoing chemotherapy or heart surgery. And that's just the top of the list. So what we're trying to do is have the cybersex trafficking survivors ordeal lessened and have their case be immediately acted on by the physician, any physician they come in contact with. That's ideal. Because all the other avenues are slower. And when I say other avenues, we're talking about changes in stalking laws, changes in how law enforcement interacts with cybersex trafficking survivors, changes in how they treat pimps and johns and traffickers, and also the public perception of cybersex trafficking. And since the pimp and traffickers are already going to send the cybersex trafficking survivors into the emergency rooms because of what they do to them, it makes no sense not to evaluate them and rule it out. Because no matter what the cybersex trafficking survivors, say in their questionnaire intake, you can still rule it out. Just because you know that this is a public health issue and that it could present into a public health issue. So that's what this podcast series was about, to get the physicians on board. And I guess the next step tier is, who's going to front the costs for taking those extra steps. And then that's an administration process, So if enough physicians, I guess, can ask the question, then and then get as close to the cheapest diagnostic tool they can use to uncover what's causing all these idiotic symptoms to present itself. And then get a higher up to okay the removal of it. and enough physicians does it, then it can be within a few months that the cost will be minimized and part of managed care. So, what should cybersex trafficking survivors bring up to their physicians? And we kind of touched on this. And one of the things is heavy blood flow, which leaves everyone tired, not enough energy to get up, not enough energy to do certain functions. STIs is another. If you are not sure of a taint or smell of any discharge, whatever, where it's coming from, go to the physician's office to rule it out. And be careful. If you went to the doctor for being treated for something else a couple of months ago and were assigned antibiotics, bring it up if your new physician is trying to assign you antibiotics for another infection. Now, nowadays, there's a prescription list to let people know, doctors know, so that they're not over-prescribing medication that are interfering with another or can pose a lower risk of immunity. But you still have to remind your physician if you got treated for something, for an infection in one area of the body, and now you're coming in and you're going to another specialist and being treated for another infection, that you let the specialist know, because they're out of the loop, that you've been treated for on a round of antibiotics for another infection. And they will have to prescribe something else. Another thing that cybersex trafficking should bring to their attention is changes in how they walk and how they carry themselves from point A to point B, because that changes. There are different pressure points that are placed on the body by pimps and traffickers that causes general weakness on one side of the body versus another. So what it entails for cybersex trafficking survivors is to take detailed notes of whatever new changes that comes up and what becomes a regular thing, and then present that to your physician. And here's why. You just never know what can happen. And this was important for our cybersex trafficking survivor who went into a routine test for a breast biopsy, and they found out that she had fibrostic breasts. And so they had to schedule to take a test of the tissue, and it took recovery time from that biopsy. And fortunately for our cybersex trafficking survivor, it was benign. So because of the idiomatic symptoms presented by the pimp and trafficker, and then the hormone stimulation by the pimp and trafficker, the body's out of whack with our cybersex trafficking survivors. So doing regular breast exams is important. Any changes to one's breasts and other parts of the anatomy needs to be presented to the physicians to catch, as a cybersex trafficking survivor caught early. And fortunately for this survivor, the exam tissue came up as benign. So, and not just because it takes diligence. So it's very important that you do not give up hope, and that, care is going to eventually happen, but we just need you to do that one little bit, and reaching out to your physicians when you notice that there is an anomaly. Now, the physicians are probably wondering, don't the cybersex trafficking survivors know that they are trafficked? And why are they asking all these questions? And for a good percentage of them, and this is small, they do not know at first until later. It's hard to imagine, but it's true. They do not know until much later. We're dealing with technology that focuses on a specific anatomy that is just for the pleasure of pimps, traffickers, and johns. So we don't know whatever circumstances that pimp, trafficker, and john had over that target. We don't know if they were drugged. We don't know if they were coerced. We don't know if they drank something and then they were compromised. But those are the circumstances that they find themselves a day or two later, when their pimp and trafficker are stimulating an anatomy part just to have their satisfy the pimp's and trafficker or John's sexual gratification. So the questions being asked: are you being trafficked? Are you in the trade? Do you have multiple partners? How many times do you engage in sex on a daily basis? These are important questions. Because by the time the cybersex trafficking survivor present themselves to you, they'll be like, I don't know how it happened, but now every single, and they'll tell you X amount of times, X amount of days, on a regular schedule, and that regular schedule is that of the pimp or trafficker or John. And this is when you'll have to utilize your tools to help these individuals. Hopefully that is the case. Hopefully that we can come to that point where the cybersex trafficking survivor will list what they've been going through, and they'll get the care so that they can resume life before trafficking. I mean, that's the end goal, right? For most cybersex trafficking survivors, resume life before trafficking. And the question is there a diagnostic tool that is relatively cheap, and how much is it going to cost to remove this biosensor from the cybersex trafficking survivor so that that goal is realized. So many of this has to do with managed care and what they can and can't do. But if enough physicians recognize this and start asking questions when patients start coming in with these idiomatic symptoms, coupled with questions, then we should begin to do what needs to be done for the cybersex trafficking survivor for their overall health. And I love the fact that, there's more than one way that a pimp and trafficker will monitor and track their targets other than, the biosensor. They'll have the targets use their cell phone to record what's going on in the room. They'll have them wear a earbud in their ear. I mean, these are the things that visually you can look for. And also whether they have them wear, Google glasses. So some physicians are aware of this. One cybersex trafficking survivor who went in because of that bleeding, wanted to rule out bleeding in the rectum, had gotten a procedure to test that area, right? And it wasn't the physician, it was the physician assistant who insisted that the cybersex trafficking survivor would not go into the operating room with her glasses. And, thought that was weird, but he says that he would not go forward with the procedure if the cybersex trafficking survivor remained with her glasses during the procedure. And on comment, not in front of the survivor, but, to his fellow, the nurses stations over there, he said, well, the reason why he insisted is because, it could be Google glasses and he could be recorded. But the fact of the matter is, some have experienced that because, it has happened. And if that has happened, then that lets you know how much power pimps, johns, and traffickers have over survivors. It just so happens that this particular cybersex trafficking survivors, there are other methods besides Google glasses that the pimp and trafficker was monitoring, but not through the glasses alone. And most physicians don't know that if you are on a network that, this pimp and trafficker can get onto, then they're monitoring your system anyway. They're monitoring what you say in the office through your cams, which is going into the next day convo. But this is what they do. So we're having another sophisticated layer of monitoring rather than, earbuds, cell phone earbuds, having your cell phone on or Google Glasses to monitor health-related conversations with a cybersex trafficking survivor. For the most part, our cybersex trafficking survivors are being monitored just by the pimps and trafficker hacking into your system and monitoring through your cams or through the biosensors that's on the trafficking target. That's the sophistication that is readily used now. That's the level they're at now, just to exert that power and control over their targets, because that's their cash cow. So what you need to ask, if they're willing to do this, what are you willing to do? Because managed care is managed care, and every, managed care likes to brag about their sophisticated networks. But if a pimp and trafficker can commandeer your networks in real time just to monitor their cash cow, you need to ask yourself, what kind of network do you really have? And this is not because they want to see how sophisticated or what your prowess is. This is just to monitor what you're doing and saying to the trafficking survivor, so that they can either A, get out of Dodge, or exert more punishment to the target, cybersex trafficking target, later. So what that entails is this. Once you uncover that this person is a trafficking survivor, and it has been, and you have discerned that you can use a certain diagnostic tool to rule out cybersex trafficking, then the next step is to do it right then and there while they're in the office. And right then and there, coordinate with local law enforcement so that when this patient leaves your office, they're not going to be encountered with their pimp and trafficker trying to exert control over them again and start the process anew. We want this pimp and trafficker out of circulation so that it doesn't do this to anyone else. So we're talking about several steps, and several coordination in the part of physicians, doctors, nurses, gynecologists, OBGYNs, because of the nature of, trafficking. Now, we haven't presented to you yet someone who's been pregnant and trafficked. But that's another avenue. Don't just rule it out just because the person presents themselves pregnant coming into the doctor's office. Because there are multiple lateral schemes. A John who's virtually having sex with our cybersex trafficking survivor. That's another cash scheme, but another scheme is their handler being an intimate partner or spouse, right? And to make ends meet, the spouse is enforcing this trafficking upon our cybersex trafficking survivor just to make ends meet. And another case of our cybersex trafficking survivor is doxing. When cybersex trafficking survivors come in because of coping mechanism or because of their pimp and trafficker exerting control and power over them, they would increase drug dosage on them. So we have this layer. So they will present themselves sometimes to treatment facilities. And this is a very important issue because treatment facilities are only going to gauge what kind of drug they're on, what kind of withdrawal symptoms they're going to have. But it's very important to realize this thing with this biosensor and what pimps and traffickers can do. And this is why cybersex trafficking survivors who are doxxed have a lower lifespan than those who are trafficked on the street and who are doxxed, just the same. Because the biosensor, they can increase their threshold, and so the need is greater. And if the need is greater, then the likelihood of overdosing is higher. Now, what I said, it maybe sound a little bit like, but what we found out, and this is just for a normal situation, and this is true for one cybersex trafficking survivor. She was taking pain medication for PMS, right? And what the trafficker behind the cybersex trafficking would do when the survivor took her PMS drug would increase the pain threshold onto the survivor. Making the medication useless. And what we've seen with our cybersex trafficking targets who've been doxxed, their pain threshold is greater, which means they are more likely to overdose and come into the emergency room if they make it into the emergency room, because their pimp and trafficker have increased their pain threshold just to make them more compliant. And and essentially what they're doing is putting a bullet in their heads. So we saw that cybersex trafficking survivors who are addicted to drugs because of their pimp or trafficker do not make it. They have a shorter lifespan than that of someone who's trafficked on the street and who's been doxxed. So this is why we're having this podcast on our doctor series, and however they present, however the cybersex trafficking survivors present themselves, whether it's a drug treatment program, they have to ask the same questions. Do you have multiple partners? Are you being monitored? How are you being monitored? Do you have multiple sex partners? How many times? Because that lets you know what you're dealing with. And you may have to refer this person to get the diagnostic tool they need to get this thing removed in order to proceed with a drug treatment program, because it will not work. The pimp and trafficker is going to control and use all the exertion on this cybersex trafficking survivor so that your drug treatment program will not be effective. And we've lost too many cybersex trafficking survivors because of a whim of some pimp and trafficker hiding behind some stupid technology. So you're talking about pain. The survivors are dealing with, who are already doxxed. They're dealing with pain. They're dealing with withdrawal. And they're also dealing with whatever the pimp and trafficker put them through. So as a matter of survival, they're going to listen to their pimp and trafficker rather than to what makes sense. So diagnosing our cybersex trafficking survivor when they present themselves to a drug treatment program because someone was kind enough to see that they needed treatment. That's step one. Step two is diagnosing whether they're a cybersex trafficking survivor and then using diagnostic tools to detect and remove that link to the pimp and trafficker, and then get them onto the road of recovery through drug treatment and physical therapy for the most part, and also group support. So we're going to be talking in our next day about technology that's been utilized. Some of it has been mentioned through our series, and you heard it here, how different pimps and traffickers monitor conversations on different medical groups, networks, depending on which doctor's office they visit, and how these conversations are not private, and what can be done to limit access of pimp and traffickers in a physician's office so that we can increase privacy. So if you're a technician out there, we'll encourage our mobile wireless technicians, keep listening, because the survivors need your assistance. Thank you for joining us on Decoding the Black Box of Cybersex Trafficking, what doctors miss, as well as gynecologists, as well as nurses, and what cybersex trafficking survivors need to bring up in their physician's office. See you in the next day. Thank you.